The Kronos brace is a typically post-operative brace, but it can be used in any setting where you really want to give somebody very strong quad assist. And strong quad assist can mean that you want to give them help and straighten the legs. So if there's somebody that has an extensor mechanism disruption and you want to make sure that this helps them walk while they can still bend their knee and it helps them straighten it, it's strong enough that it can do that. But if there's also situations where they can't even support themselves, the quad is so weak that you want it to function like a locked out knee brace, then this can basically tighten up enough that you get it to where you basically can't break it and it functions as a lockout knee brace. That's one of the uses of the Kronos brace. Another use of the Kronos brace is that it can allow for up to 15 degrees of hyperextension. And so you can see that if you release the tension that's on here currently, that would get you to about 0. And then you can crank it up to help someone stretch and get into their normal hyperextension. So if you have a patient that has a flexion contracture from an acute knee injury, if they're recovering from a surgery like an ACL or a knee replacement, we're trying to make sure they don't develop a flexion contracture, then it can be very helpful for all of those situations. The idea is to not have patients immobilized for any significant period of time, if at all, and to give them a functional option in between a brace that's either locked out or unlocked, or that has a certain range of motion set to it. So this will allow for somebody to have quad assist and assistance with obtaining hyperextension. One of the reasons to use the Kronos brace is not just for the functional benefit of quad assist and improved range of motion and hyperextension, but it's also to help get patients up and moving faster and easier, more comfortably, so that they don't have to be immobilized, that their quad doesn't atrophy. So even though this does assist the quad actually can build up faster because you're using it more than somebody that's trying to walk around with a peg leg locked out straight. So this should result in patients being up and moving faster, having quad function return faster, and also have better range of motion by helping them get their hyperextension. Since this has come out, we've had a pretty significant experience with it, and it's actually been excellent for patients. For some patients, we transition from a standard post-operative brace that's a hinge knee brace to this at 2 weeks once their swelling is down and they can handle it. And usually when they put it on, they're immediately significantly impressed. They're like, this fits much better, it's lighter, it's more functional. I'm so glad to get rid of the brace that I was using before. So we find, especially when patients have either experienced the prior bracing from a previous surgery or if they're using some different bracing immediately post-operatively, we find that their transition into this, they're very happy about it because they can already see as soon as they put it on the office, with the assistance and extension, and then still allowing them to bend while in it in a fluid manner, they can just start walking more normally. They can clear their foot easier. They don't have to lift their leg or their hip. So they really start to feel much more functional actually the day we put it on them, which is always fun to see.